And I'm very happy to be able to introduce to you my colleague, Dr. Andrea Moser. Andrea is probably one of our foremost and most knowledgeable long-term care physicians in the country. I have the pleasure of working with her on our behavior support unit. She has worked in leadership positions at a local level, at a provincial level, at a national level. Anything we need to know about long-term care, I think she's the right one to ask. So with that, she likes country music. That's the only downside, but you know, each to their own. So with that, I will turn it over to Andrea to start our presentation.
I know I was listening to Bruno Mars on the way to work this morning, and there was the song about it's a good day to stay home, and I thought it just resounded with us for right now. So full disclosure, I am not a COVID expert. I think I am like many of the rest of us, where we are scrambling to try to learn what we can learn. So what I've been asked to talk today about in the next 20 minutes is around preparing your long-term care home for COVID. And I know everyone is dealing with different issues across the province, but this is just sort of trying to set the stage of if you don't have COVID in your facility, or also if you are managing it, what are some of the things that we can do proactively to try and keep the system moving. So I'm going to, I have no disclosures or relationships to commercial interests, and no extra funding. The potential mitigating bias as with all the other ECHO sessions. So I'm going to try and talk about some approaches to prepare for COVID, talk a little bit about digital health. It's an extra little role I have here at Baycrest as the Chief Medical Information Officer, which is quite unique to a long-term care or post-acute setting. Talk about what we could be doing in advance around advanced care planning discussions, and then just some stuff that I'm hearing from a lot of phenomenal experts in long-term care, both from my colleagues in the US as well as colleagues across Canada, in terms of what are they thinking through in terms of proactively looking at how we manage with medications. And again, I say this slide deck is cobbled together. I'm a cobbler today because trying to find information on a moving target is not easy, as all of you can recognize. And I think we all are overwhelmed with webinars and resources and emails and listservs and discussion groups and chats and directives coming from the ministry. And so really, how do we collate it all, and how do we find the kernels that are really necessary to navigate through this? So I'm going to try and do that for us today. So why are we here, and why is this important? This is our new reality with COVID, and COVID, as we know, when we turn on the news every evening or every hour of every day, and we hear about the particular risks of COVID in our long-term care population. We know mortality increases with age, with frailty, and with comorbidities, and as those increase, the mortality also increases. So while we hear 2 to 3% mortality possibly in a healthy younger population, that seems to be increasing exponentially to, it's now estimated at about 50% of residents in long-term care homes, if they get COVID, that's the average mortality rates. And obviously some residents in long-term care will have less than that, and some residents in long-term care will have a higher fatality rate. And why is that? Well, we know who we care for. We care for residents who are older. Most have some assistance, if not extensive assistance, with their activities of daily living. So that frailty scale, when we think about a frailty scale of 1 to 7, and most of our residents are in the 5, 6, 7. And if we use a frailty scale of 1 to 9, they're in that 6, 7, 8, 9 range. So these are people who are really needing assistance, which is why they're in long-term care. Many have cognitive impairment, estimated about 60% with actually a diagnosis of dementia. And then we all know that our residents have multiple comorbidities, cardiorespiratory illnesses, diabetes, chronic kidney disease, all those things which put you at a higher risk with poor outcomes with COVID. So I thought I would just take a pause and let's talk about crisis management, because that's really where we are. This is moving more quickly than I've seen anything move in my career in healthcare. I've been in it for a while. And really, when we started hearing reports coming out, January, and then we started hearing trickling in February, and then suddenly in March, boy, we were all hitting the ground running. And just now, over the last few weeks, we're hearing more and more of our colleagues, and some of you may be on this call, who are really dealing with phenomenal situations in your long-term care home. So when I look to the literature around crisis management, there's really 4 stages. Some say 3, some say 5, some say 8. But let's talk about 4 stages. So there's the prevention and mitigation. Okay, so when we started hearing about this last January, did we start thinking, could this apply to us? Could this apply to our clinical practice? What if it gets into Ontario? What if it gets into our nursing homes? What can we do? How can we learn? Preparedness, how are we actually, now that we think it might be coming, what are we doing? How are we getting ready? How are we making sure that we have the equipment, that we have the training, that we have everything in place to be able to deal as much as we can deal with this situation? And then that planning, I think the real, the beacon of light, I think, in this for me is that we're seeing this planning in long-term care. Now we're seeing other sectors stepping forward. So how is acute care also planning for helping with long-term care? How is our specialist communities also helping with long-term care? How are we mobilizing infection prevention and control and planning for that? And then the response, that's really, you're in it. This is now happening. You're on the ground. What can we do to make things as safe as possible? How do we make sure our residents are fed? How do we make sure our residents are cared for? How do we make sure that all their symptoms are being managed and that everybody's in the loop on that? And then I think the other piece that we have to think about is down the road, the recovery. What's the new normal? What's our new desired state? What have we learned? What have we done well that's really worked? Where are there some other learnings? What are those? I had a group of colleagues talking with me. What are the Trojan horses that have now gotten into long-term care and we don't want them to leave? So what are some of those extra supports that are now wrapping into long-term care that we could say, boy, before we had COVID, before we had this pandemic, these were things that would have really been supportive to our sector. And this is just showing this in a more of a pictorial way. So those of you who are visual learners, that sort of that capacity building, how are we mitigating, how are we preventing, what are we doing before it's not my home yet, but what could I be doing so that we're ready? And that's what we're going to talk about today. And then that event comes in the response and the recovery. And I think what we wanted to ask, and do we have a polling question to come up? We really wanted to get a sense of, for all of you on the phone today or on the line today, where are you at? Where do you think you're at in terms of your clinical practice, in terms of your long-term care practice? Where are you on this cycle? Are you in the mitigation, kind of watching from afar? Are you in a more active preparedness, getting ready? It's in your community, you know it may be coming. Are you in the midst of that response effort? Unfortunately, I don't think any of us are in recovery stage yet. And then who of us are really unsure? We're not quite sure where we're at. It seems like a mix of everything going on. So let's just see what people's thoughts are on this. So the Mentee Code, this is, you go to mentee.com. I think folks used this last week, and you use the code 475142. So I'm seeing people are looking, I think we're seeing the numbers coming up. Just take a little moment for people to get through that. Yeah, some people saying they're in the middle of sort of mitigation and preparedness, so they're sort of juggling two, preparedness and response. Okay. Yeah, great. So hopefully that's great. Okay, so do we want to move on? So really, some of us are in it, and some of us are preparedness, and some of us are doing both. I would say in our facility, we're doing a couple of these at the same time. So I'm just going to bring a smile to folks' faces. This is my life right now when I'm not on webinars with COVID. So this is, I think about preparedness for COVID, and maybe this was after too many hours of putting this together on Sunday, but it's kind of like having a new puppy. So you think, oh, isn't this we're going to have a new puppy, we're going to get prepared. So we make sure we have the kennel, we make sure we have the right food, we make sure we have the right, leash and collar. And then, you have this wonderful plan, and then the puppy arrives. And, it's a little bit more than what you had anticipated for, and you work through, and some things you learn my daughter is learning that, you know, as the puppy wakes at 5 in the morning, we should keep the puppy in the kennel because otherwise the puppy wants to get up and play. And so how are we going to course correct and check things? So when I started walking through that disaster management cycle, I thought about my home with the puppy, and hopefully the recovery stage is that we're going to have a wonderfully well-behaved, lovely, cuddly Labrador that brings sunshine to our lives. So anyways, that's moving forward. So what are we doing? So I think these are really the crux of it. I'm trying to, three big topic areas, I think. One is the outbreak management, so the infection control piece. So who is your team? Who are the point people in your team? And we know long-term care, we all have a lot of changes of staff that happen. So really that resetting, who are the people who are the core team? Who are the people who are the broader team? Where are you at with PPE? So we've heard a lot about PPE. So where are you at? What are your current stocks? What's your current use of it? And do you know who to contact if you need more PPE? And that's been changing now as well. There's hospitals that are being paired off with long-term care homes to help in terms of that. So knowing who those people are, who are the contact number, what's their phone number, all of that. Confirm also who is your public health contact, and make sure you know who those people are. And then one of the other things we're hearing about in the field is really, this is a time to really, if you have the time and you can do this, we all want to be doing something. We're all caregivers, we're all in healthcare, we're all trying to help with things. So this is a really great time where you can do some things. So let's refresh our staff training. Let's think about what would we do. I've heard about some homes that are starting to do what they call a mock. So, you know, you send a note to the leadership team, we now have a COVID case, and you run through a mock of what does that look like? Who would you call? What would you do? What does the caddy look like that's going to be outside of the room? How do you notify the physician? How do you notify the family? How do you work with your team and manage all of that? So I think those are really great ones. The other one we're hearing about is donning and doffing PPE. So pairing up, or a buddy system where people can actually watch each other putting on and taking off the PPE. And there's a lot of videos that are showing up now on YouTube that are really quick reminders of this is how you can do it. And then the other one, well, in terms of preparedness, is reach out to who's providing your environmental services in your home. How are we managing things now? What would that look like in the event of if we had more cases of COVID in the home? What would that cleaning schedule look like? How are we going to be doing that? How do we involve the environmental services people? And this list was not fully, you know, there's all sorts of other folks on there, dietary, your lab services, all of those. And then the next one that I just wanted to touch on is, what about digital health? So we've heard a lot about telemedicine. It's on the news. We can do telemedicine. It's wonderful, wonderful, wonderful. But really, how are you prepared for that? And as a nursing home, have you used telemedicine before? What is your digital health strategy, or your ability to enable digital health in your home? And that goes to things like your electronic health records. We know everybody in long-term care has an electronic health record. What's your access? Do physicians, do your attending NPs have access if they're on call, if they're at home? What does that look like? Can they, what is your call group for physicians? And do you need to look at extending access to that group? Do you have order entry that's available remotely? Are you relying on verbal orders, and what does that look like? Even if you're doing verbal orders from physicians who might not be able to come in site, what's their access to things like the electronic MAR? Do you have that in the electronic record? So there's a lot of things in terms of touching base with the providers who might not be coming in as regularly. How can they access, and how do they know how to get the information out of that record once they have remote access to it? The other one we're hearing from a few facilities in some of the regional work we're working on is that not everybody has access to Connecting Ontario. So all long-term care homes should have access to Connecting Ontario. My understanding is the two major vendors for records in the province have what we call an integrated solution with Connecting Ontario. So that's something that if you're not using it in your facility, you don't have it currently, if you're not in that pandemic outbreak situation and you have some time for some planning, this might be something to really consider. In Connecting Ontario, we have access to the community lab results, dispensed medications, as well as hospital records, so consultations, discharges, admissions, etc. And I know John is saying in the Southwest, it's called something different. So there's Connecting Ontario, there's eConnect. Everybody has their own name of it, but basically it goes through the same portal, and it gives you access to things that we never had access before. And as a physician working in long-term care for over 25 years now, this is a game changer, having this information. So being able to see that lab work, not waiting for the facts to come in, being able to see the history of those medications and that recent admission if there was one in hospital. Next one, telemedicine and virtual care. So I think there's two real components around telemedicine that we're seeing, and it's really quite phenomenal seeing people enabling this to enable visits with family members. I had a resident in my facility who told me she attended her Passover Seder through Zoom. And she had never done that before, and she thought it was quite remarkable that there were all these family members from across North America who were connecting on this Zoom call. So really, how can we support that, and how do we enable that within the nursing home? And there's just phenomenal experiences with this we're seeing. And virtual care, it doesn't necessarily always have to be a video chat either. It's how are you enabling a phone visit with families? So those families or residents who don't have a phone in their rooms, how are we supporting so that they can have that connection with their family member? Our recreation programs, arts and culture, there's just things that are coming out all over the place around really enabling that telemedicine. And I'm really quite impressed. Even our residents who have moderate, if not more moderate cognitive impairments can still respond to this approach. And then the virtual care, or the care for clinical visits. So your consultants, your attending physicians who aren't able to come in for a variety of different reasons, and or may are cutting back on their visits because we've all been encouraged to do sort of those emergency, those urgent, those essential visits only. So how are we providing that care in the home, and what does that look like? One of the things we do know is how are you able to facilitate that visit if it's happening? So I could be at home and ready to go with a virtual care on a video call, a Zoom call to see patients or residents in the nursing home, but there needs to be someone on the other end who's able to facilitate that. So within your home, think about who that can be, and it doesn't always have to be a nurse. We know the amount of tasks that are on the nursing team is quite enormous at this time. So who else in the home maybe can support that care? And then medical staff planning. I think this is really important. Connect with your medical director. Hopefully your medical director is engaged in working with administrative team and the leadership in the home. Really, what is our complement of physicians? Who's coming in? Who's not coming in? Who might have to be on self-isolation at home? Who may not be able to come in and do visits in person because of health reasons or other reasons? And then what does that look like? And do you have a contingency plan? Do you have a home that are reliant upon one attending physician and one medical director if they're not able to provide service? What else could be in place? So we heard about sort of a backup medical director or another group of physicians in your community who might be stepping forward. And we're hearing every day about physicians who are stepping forward and putting themselves on lists to support long-term care homes. This is a great time to refresh your on-call schedule. Does it make sense? Is it working? Is there any tweaks that need to be made? And then the other big conversation is how do we prepare in terms of our medications and our emergency drug supply? So have we reviewed that list? We all have that list. This is a great time to review it. So how are we making sure we have the medications on board for residents who are going to be choosing to remain in the home when they're sick, even if they don't have COVID, versus those residents who do have COVID? How are we making sure we have the medications in stock to provide the care for mild or moderate symptoms of COVID, and then also those residents who have more end-of-life care needs related to COVID? So our hydromorphone or haloperidol or lorazepams or midazolam. What does that look like? Okay. And the other one that we're being asked to do, and I'm really quite impressed, some colleagues of ours are really taking this on in full speed ahead, and really looking at what makes sense in terms of managing meds during COVID, and can we compress medication time? So do you have a medication 9 to 9 and then 8:30, 12:35? Can those be changed so that we're really respecting the workload of the nursing team in terms of the number of med passes that are in place? And are there some medications that we can actually hold off on right now? So are there medications maybe that don't have a really great clinical benefit? This might be the time to stop those multivitamins, the vitamin A, the vitamin B, and then which ones are not concordant with the goals of care. So if someone's goal of care is comfort only, is it really worth having that statin, having that aspirin on board at this point in time? And then there's some of those medications that we're really, really important, but can we take a pause on them for a few months just to get us through this period? So things like your bisphosphonates or your vitamin D, again, keeping in mind your resident. And then what we talked about was that consolidating those administration times. And then another group are really coming forward and saying this is a time also, do you need to be monitoring some of the medications as frequently as we are monitoring them? So it's a time to take pause and say, how often am I doing things like glucometers, blood pressure checks, all those things, and what is reasonable for the residents that we're caring for at this point in time. And then lastly, and very importantly, is this whole concept of advanced care planning and having conversations with families, substitute decision makers, and residents around their understanding of their illness, providing information not only of the illness they have, but in the event of COVID, what could that look like? What does that mean? What are their values and goals that they're making decisions around their health for? And then can we make a plan? So in the event of COVID coming into the home and somebody who's at very high risk for who may have a very poor prognosis with COVID, then how are we making sure that we have that plan and care to support that person with a dignified approach and as much comfort and symptom management as possible. Great resources. Speak Up Ontario actually has a new guide specifically for residents in long-term care with mild or severe COVID infection. So if you haven't seen that, that's a great resource to look at. And then I also came up with a couple of other resources. I'm hoping that you've seen these already, but you haven't. I think these are some great ones. The Ontario Long-Term Care Clinicians, that's formerly the Ontario Long-Term Care Physicians. They're coming out with almost daily updates, and within their news briefings, they actually will put a title. So it'll tell you what's in that particular newsletter. And on their website, the oltcc.ca /news, it actually updates all of those with the resources. So for example, if there's a new resource that came out around a palliative medication list, it'll actually show you that in this summary, which is super useful. And then the American Medical Directors Society, I'm putting that up just because that was the first resource I came across. They had this in long-term care homes before we did in Canada. And there's really, there's a lot of archived webinars and some resources on there that can really frame this in terms of what it's like to be living through that and some experiences that we can learn from. And then Pallium Canada, which is our palliative care education site, they've actually provided free of charge some modules around end-of-life care related to respiratory symptoms, as well as goals of care and advanced care planning. So all of these resources on this page, you previously would have had to be a member or paid a membership to access these. In the spirit of COVID, all of these organizations are providing these resources free of charge to both members and non-members. So you can go and take a look. And I think that was what I wanted to talk about was, let's get through this. We're all in it. Let's not forget about our physical distancing, even when we're on our units and providing care as much as we can. Wear our PPE and stay informed, and also please take care of yourselves. This is a marathon, not a sprint. So thank you all.